It's been about 2 weeks since House Republicans passed Trump's budget bill. The pressure is now on Republicans in the Senate to do the party the same favor. While President Trump's administration has called the big, beautiful bill as ending taxpayer-funded health care for undocumented immigrants, some are worried about its widespread impacts also on cutting funding for Medicaid. Here's Sammy Salina.
The big, beautiful bill is still pending in the U.S. Senate, and while lawmakers are preparing to take up this legislation, Minnesota's Department of Human Services is bracing for its effects.
That would impact their ability to provide care and to employ folks, and professionals.
John Connolly is the state's Medicaid director. He says the bill is, quote, inefficient, ineffective, and fundamentally unfair.
If there is a reduction in $500 million in federal funding annually, we will have to balance a budget, and that will pose some very difficult questions with respect to provider reimbursement.
Because of that loss in federal funding, the department expects it will cost the state roughly $500 million. Between 152,000 and 253,000 Minnesotans could lose coverage. That's according to Kaiser Family Foundation. There will also be changes to the reimbursement structure for providers, along with work requirements for some Medicaid recipients.
The numbers we're talking about are really frightening.
Dr. Emily Chapman, Chief Medical Officer for Children's Minnesota, feels like the face of Medicaid is getting lost in the debate.
For Children's Minnesota, 50% of the patients we serve depend upon Medicaid for their coverage.
However, some Republicans say they need to make hard decisions to help the country's deficit, including Wisconsin Senator Ron Johnson.
I'm a supporter of what's in the big, beautiful bill. My problem is it's just because it's so hard, it's not going far enough. And if we just pass this, if it's a one and done, we will not be really addressing the major problem here in terms of massive growing deficits and debt.
DHS highlighted programs the federal government is targeting. A majority of the loss comes from a proposal to reduce the percentage of Medicaid costs for the expansion group to states providing coverage to undocumented people. It would also prohibit Medicaid funding for gender-affirming care and family planning clinics.
Regardless of what population we're talking about, we see this as a threat to the well-being of our next generation.
Jana, DHS says this could result in people avoiding preventative care visits because it costs too much. That results in more ER visits as a last result.
And that's always been the thing with health care. I remember it for many presidents that were trying to change health care over the last 20, 30 years, is that if people don't have access to care, they're going to need care at some point, and then it's just the cost just skyrockets because it's emergency care.
Yeah, that's something that all healthcare professionals say and stress, that if we spend a little bit of money now preventing some big things from happening in the future, it could actually save money in the long run. But Republicans say we need to cut now.
Yeah, we need to cut the deficit, but we need to figure out a way to get it all done. Thanks so much, Sammy. I appreciate it.